Good morning, everyone. Welcome to our live session. I'm your host, Maitri, and today we're diving into a very relevant topic, common ENT conditions in winter. We're delighted to have with us Dr. Noor, a renowned ENT, head and neck surgeon. Welcome, Dr. Noor. Let's jump right in. Dr. Noor, many of our viewers have been curious about why ENT issues seem to spike during winter. Can you shed some light in this?
Thank you, Maitri. It's a very relevant question. There are a lot of ENT, ear, nose, throat related problems which spike during winters. There are multiple reasons for that, and the most important is because of cold temperature, the air becomes dry. So the dry air, it causes dryness in your nasal cavity also, and nose has to put in extra effort to condition it, add more moisture. Sometimes because of the excess moisture, it starts dribbling from the nose also, and the allergens in the air, they're more condensed, so you're more exposed to a lot of environmental allergens. Flu is very common, sore throat, that dryness in your throat makes it more prone to infections. So viral infections, viral flus are more common during winter season.
That's insightful. Speaking of infections, what are the most common ENT conditions you see in winter?
During winters, we have a lot of patients with cold, flu, sore throat, recurrent tonsillitis, pharyngitis, and even earaches, so acute otitis media, and exacerbation of sinusitis, allergic conditions, even asthma. So all these conditions, during winters, there is exacerbation.
Are there any specific symptoms people should look out for?
Yes, soreness in your throat, nasal blockage, loss of smell sensation, constant and recurrent earaches and severe earaches. Even sometimes nowadays there is an infection going on, viral parotitis. There is a swelling in this area with pain, and sometimes fever also, associated fever. So these are the common conditions which usually people suffer from during cold winters.
Great advice. And are there preventive measures we can take?
Yes. The sudden exposure and sudden change in temperature should be avoided, and whenever you're outdoor, better is to wear a mask so that there is less exposure to environmental allergens.
Those are practical tips. Now, a common question from our viewers: when should someone consider seeing an ENT specialist?
As I just said, a pediatric age group, even adults suffering from pain in the ear, persistently nasal blockage, constant fever if they have, and if they have discharge from the ear. Nowadays, as I said, this swelling in this side of the face because of the parotitis. So if they have constant fever, severe pain which is not settling with over the counter this analgesics, antibiotics, they should see their doctor.
Dr. Noor, there is a new COVID variant happening. What are the relevant ENT-related symptoms?
COVID is a common viral infection. It has not gone completely. So the common ear, nose, throat related symptoms which we see in our practice in COVID patients is one is loss of smell sensation, upper respiratory catarrh. Sometimes patients have presented with sudden sensorineural hearing loss also, so which becomes an emergency to treat. So these are some of the soreness in their throat, constant soreness, irritation in their throat leading to cough. So these are the common symptoms which COVID has caused.
That's insightful. As the new COVID variant is in the air and the pollution level is high, what do you recommend for the general public?
See, again, there's a lot of pollution in the air, and COVID also is again coming back. So better is to take precautions like social distancing, constant this hand sanitization, and wearing a mask, keeping a distance. It is important. these winter months are more, the symptoms get exacerbated in patients who already have certain conditions like deviated nasal septums and nasal polyps. So they get exacerbations during these COVID months. So they need special precautions like wearing a mask whenever they go out in dusty and environmental. They should avoid dust and fumes.
If someone is experiencing a cough for more than 2 to 3 weeks, Dr. Noor, what are the chances that they might have a disease or something?
Constant or persistent cough for more than 3 weeks, we must, there are certain diseases like tuberculosis, which is endemic here. We must rule out tuberculosis. There are other diseases also, but this is a very common disease. So a persistent cough for more than 3 weeks, we must get ourselves checked and go to the specialist.
Thank you, Dr. Noor, for these invaluable insights. Before we wrap up, any final thoughts or advice for our viewers?
Just during cold, wear a mask, take plenty of fluids to wash out allergens from your throat, and the sudden temperature variations, they should be avoided. Less in because there is a lot of pollution outdoor, so too much of aggressive activities and strenuous exercises should be avoided.
Wise words indeed. Thank you, Dr. Noor, for joining us today and sharing your expertise. And thank you, viewers, for tuning in. Stay healthy and stay warm this winter.